There's actually a lot of resources available to us in Ashtabula County. One of the things that we struggle with at the board, but as providers too, is really getting that word out there and getting the information to the people who need it.
Of course, there are multiple paths to recovery. There are multiple treatments for any disease process. I have, an arsenal of tools to treat hypertension. Somebody has high blood pressure. I have 50 different medications I can try. I have diet and lifestyle modification. We can direct them towards weight loss and activity. We can also treat some of the underlying causes, so if there's underlying heart disease, underlying vascular disease, we can treat those things. And to have every person that comes into the office with high blood pressure and say, here, you're getting this one drug, and send them on their way, I don't think that's good medicine either. So to do the same for addiction is not practicing medicine.
First and foremost, if you're looking for treatment, I would recommend that you call the county. I know Glen Bay, I know Signature Health, I know a number of the larger providers, and then you can typically find some private practitioners if someone is not willing to attend IOP, which is intensive outpatient or outpatient, that can do one-on-one therapy and hopefully work with them to kind of motivate them, since most folks need a little bit higher level of care when it comes to addiction.
One of the greatest resources that I can say would call to that would be our ability to call 211 in this county. Having the 211 service has been instrumental in linking people to resources, not just for addiction treatment, but for many different kinds of human needs and aspects.
The number one thing that you can do is to call the Hope Line. With the creation of the Hope Line and with kind of warehousing at least access points for everything under the Mental Health and Recovery Services Board, I think that that's the first thing. Call, say, hey, listen, we can get you to one of these 2 or 3 places, meet with somebody, and they can tell you specifically in your situation what you need. I think that calling that number is key. Before you call that number, I think you first have to realize that there's a problem.
First, I would definitely start with contacting 211. It's a great place to start. They have a lot of information about all of the services in our county. You can also contact our Hope Line, another resource that can give you the right resources and the right references at the right time. The Ashtabula County Alcohol and Drug Treatment Resource Manual, and that can be found on the Ashtabula County Mental Health and Recovery Services Board website. Many people probably have seen this before. It's the Ashtabula County Family Guide to Community Resources. This really has kind of a thumbnail of all of the resources that are available to us in Ashtabula County. Right on the front, it has the dial 211 if you have more questions.
There are individual counselors that have some skill not only in mental health but with chemical dependency. There's great places like Signature Health here at Glen Bay and others, of course, that offer a very wide range of services, from outpatient therapy, which is typically once a week group sorts of things, to intensive outpatient, which is usually 4 days a week, 3 hours a day, as well as inpatient treatment like what we have here, where someone's here 24/7.
If you're aware of treatment centers in your area, or if not, most counties have an addiction hotline that they can call that will direct them to a starting place, a central assessment office or a detox unit or something like that.
You can always contact your county health department, and they will actually get you connected with credible agencies and resources. And when we talk about that credible component, I think it's really critical to speak to what you were just discussing. I hear people saying, I need to go to Florida or California, and we know that's not true, and we also know that there's some really unethical practices that are happening there. So start with the county health department and branch out from there. I have not personally used them, but I know now that you've given us some, we absolutely will.
If someone's not familiar with 211, there's other services available. Contacting the local mental health board could be an option. There's treatment cards that can be shared amongst people within the community, and just word of mouth. Asking someone, talking to people, building relationships is a vital part.
One of the things that we do here at Glen Bay is we have a Discharge Coordinator who specifically specializes in helping people get hooked up to the next level of care. And then our admissions department is just phenomenal, in that we take the time, if somebody calls and they're not able to come here for treatment, we get them connected to another agency where they can get help. Lastly, you can seek out, as I said earlier, EAP services or counseling, and you would never have to share a name, but there is that confidentiality piece where you're maybe able to process a little more detailed issues that come up, and you're sure that you're maintaining confidentiality and taking care of yourself as well as the people that you serve.
For family members, I'll direct them a lot of times to the addiction hotline, but always with the recommendation that they seek some sort of treatment for themselves, either in the form of a 12-step family group like Al-Anon or Nar-Anon, counseling for a family member. Even though I know they're calling because they're very concerned about their loved one, the concern for their loved one can also start to become pathological for them.
You can always contact the Mental Health and Recovery Services Board directly if you really don't know where to start or you don't know what resources are available. You can contact us at 440-992-3121 and we can point you in the right direction and let you know what resources are available. But again, you can always dial 211 or contact our Hope line. We also have the Your Life Matters cards, really are very helpful for those who are currently struggling with addiction or family members who might have a loved one who's struggling. The signs and symptoms of an overdose emergency, what you should do, what you shouldn't do, and it also has contact information for local treatment options, and it also has the number for the Hope line. So that number is 1-800-577-7849, and that is a great place to start if you need resources.
The marvelous little information piece that has been put together can really guide the process. There's tremendous availability of services here, and look at it as your son or daughter. What would you do for them? I would go to any length in understanding based on knowledge through the internet. I would make calls. I would do anything to help my son or daughter. That's what I tell people.